All right, today we're going to talk about dividing up healthcare. Let me go back to the original slide. So, dividing up healthcare. Given the lack of financial means by many, if not most, to appropriately afford healthcare, do people have a right to healthcare? This is a good question for you guys to ask. You can ask in our discussion board post as well, and discuss it with other people. Do you think people have a right to healthcare? If they do, who should get the healthcare? Who should pay for it? And what is just? So, some find that in our free and prosperous country, such services as healthcare should be accessible to everyone. But this is not the case, and many go without it. So, given the fact that we are in a wealthy nation, and with that wealth comes many affordable amenities, including healthcare, some people say that since we're so wealthy, that it should be accessible to everyone. But of course, this is not the case, and many go without it, even though there are some who say that it is a right and that people should be afforded free health care. And that's, of course, a debatable issue as well. Even so, many go without it. So in 2010, almost 49 million Americans were uninsured under the age of 65, and this includes 8 million children. So we had 8 million children, which is, it's terrible, right? 8 million children and 49 Americans under the age of 65 overall. That would include me. I'm uninsured as well. So I'm one of those who is included in this statistic. But in 2013, right before the Affordable Care Act, ACA, or Obamacare was passed, 44 million Americans under 65 were uninsured. So we did see a slight drop, but that was right before Obamacare or ACA was passed. ACA was a bill which was proposed by the Obama administration, and what that suggested was that we should make health care available through a public option, but not the same option as, say, for Bernie Sanders or someone like that. Rather, it was through private insurance. It's not single payer, it's through private insurance, but the government could negotiate costs and bring costs down. So being that the United States government is negotiating with the insurance companies, they're able to get cheaper rates, and since they're able to get cheaper rates, it makes it more affordable. This was the plan. And that way you could sign up with Obamacare and pay much lower premiums. Now, by 2016, there were 27.6 million uninsured Americans under 65. So it did drop the rate significantly, or the number. It certainly dropped the number of those who are uninsured significantly, and that's a good thing, right? That's definitely good. But some would argue that is simply not enough. While the ACA helped decrease the number, it didn't drop the number enough in some people's view. The reason insurance, even more affordable, is so expensive, and some were not eligible for the public option. So even though it's cheaper to purchase health care, it was still too expensive for some people. And as well, some people weren't eligible because of some pre-existing health care issue or what have you. Even though supposedly pre-existing conditions were supposed to be covered, some people found that this wasn't always the case. The consequences of lacking health care. So when people don't have health care, here are some of the consequences. Less likely to receive medical care, that just makes sense. If you don't have insurance, you obviously can't afford the health care costs oftentimes. Prescription drugs, if you require prescription drugs, that's another issue. Preventative tests, you're not able to get the sorts of tests that would be necessary to to see if there's any if you have any conditions that can be treated, as well follow-up care. So if you do know that you have some sort of condition or what have you, you're not able to get the appropriate care for that. Traditionally, most that were 65 or younger received insurance through their replacement employment. That's generally how most people in this country get health care, through their replacement employment. However, in recent years, fewer and fewer places either offer it down to 57% to 2013 to 69 in 2000. So the employer doesn't qualify for treatment, or the quality of insurance has gone down significantly. So even though lots of employers offer it, the quality of care has gone down, and the number of employers offering health care has significantly dropped as well. So that's a problem as well. Medicaid covers many over 65 as well as those under 65 that are economically challenged or disabled. So one option is Medicaid. Medicaid is a program, a government program, which covers those over 65. Once you get to a certain age, you get free health care. And if you are mentally challenged, or if you have a significant economic, significantly challenged economically, then you also qualify for Medicaid as well. But there are critics of the U.S. healthcare system claiming it is far too expensive. As of 2017, the U.S. spends $10,000 per capita per year. That means for each person, there's $10,000 the United States government spends on healthcare. The closest country is Switzerland at $8,000. So we're $2,000 more than one of the richest countries in the world, and we still surpass them. So in the U.S., healthcare is allocated through managed care, a system for providing care to a specific group of patients using regulatory constraints to control costs and increase efficiency. So the allocation of healthcare is through what we call managed care. It's a system of providing care to a specific group of patients. So they allocate it based on need and based on cost. Managed care plans include HMO, Health Maintenance Organization, or PPO, Preferred Provider Organization. Attempts to cut costs may be at odds with patient care. The ACA was an attempt to cut costs and increase efficiency. So these two managed care plans, HMO, I'm sure you're familiar with these two, or PPO, were ways in which these organizations of organized healthcare organizations would not only they would negotiate these prices, but they would also ration or manage the type of healthcare that's being done. They would look at a particular set of potential treatments, and they would see which one's cheapest, and then they would look at the most cost-effective treatments and manage that so that they could bring the costs down. They could save money as well as the patient. So it seemed like it was a good plan because you have these individuals that are looking at the different healthcare procedures that could be done, and they're looking at all the different options. There's not always one option, there's several options, and they manage it based on choosing the most cost-effective and the most efficient ones for the patient and for the healthcare plan. Of course, some people see this as being at odds with patient care because oftentimes they will not, or they will refuse a particular procedure that the patient may need for the purpose of saving money. So what duties does the state have towards its citizens? How much should the state do to ensure the well-being of its citizens? What benefits should citizens expect from a state dedicated to promoting the general welfare of its citizens? So these are some questions you can kind of think about, reflect on. If you want, you can bring it up in some of our discussion boards and ask some of your fellow students what they think about these questions. So when we struggle to understand what justice there is in the providing of and availability to healthcare, this is expressed in two types of justice. You have distributive justice, and this is justice regarding the fair distribution of society's advantages and disadvantages, or benefits and burdens, including income, property, employment, rights, taxes, and public service. So this is the distribution of the society's advantages. Libertarian theories of justice, the benefits and burdens of society should be distributed through the fair workings of the free market and the exercise of liberties of non-interference. So distributive justice is where you have some sort of government agency or people come together and they distribute societies or the medical care based on need and based on what is fair, based on what each community and what each individual needs. The libertarian it's based simply on the free market, and if you can afford it, you can get it. If you can't afford it, you can't do it. So you just need to take your own personal responsibility for preparing ahead of time for the types of medical needs that you may have for yourself. It's more based on personal responsibility rather than social responsibility.